Government of India has released a set of new draft guidelines on passive euthanasia. The Union Health Ministry's draft guidelines, articulated by AIMS, will now give patients suffering from terminal illness the right to choose death. The draft further explains terminal illness as an incurable condition wherein death is inevitable in the foreseeable future. Passive euthanasia is where medical treatments are deliberately withheld for patients. This includes taking away ventilators, feeding tubes, and stopping medications, allowing the disease to worsen in the patient, leading to death. This is often the case when the patient is terminally ill and is virtually left without any chances of recovery or is in a state of coma. This, of course, is in stark contrast to active euthanasia, where the terminally ill patient is killed intentionally on voluntary request by the doctor. Back in 2018, the Supreme Court of India legalized passive euthanasia. The Health Ministry has laid out 4 conditions for carrying out passive euthanasia in its draft that has left the medical fraternity miffed in a way. For a doctor to carry out passive euthanasia, the patient must be declared brainstem dead as per the Transplantation of Human Organs Act 1994. In medical terminology, brainstem death is complete cessation of all brainstem functions. The draft also stated that the doctor must take a call on removing life support measures only if the medical prognosis of the patient indicates that the disease cannot be cured from any further treatment. Further, the doctor must take into account any refusal family members and guardians representing the patients to remove them from life support. The doctor should also duly comply with the procedure prescribed by the Supreme Court. Furthermore, the Supreme Court's legal principles stating that an adult patient can refuse life-sustaining treatments even if it leads to the patient's death. The life support can also be withheld for patients who have lost the decision-making capacity by submitting an advance medical directive, which is a declaration given by the patient's family or guardian. A cohort of at least 3 physicians from the primary medical board should take a call for a patient who is not in a condition to decide whether he or she should require life support treatment. The primary medical board must explain the illness, medical treatment, and the consequences of taking and not taking additional medication to the patient's family or guardian. Further, a secondary medical board will later validate the decision taken by the primary medical board. To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.